Trinity Health, a national hospital corporation with an annual revenue of more than $19 billion, is trying to close 71 child and adolescent mental health beds at Providence Behavioral Health, deemed by the Department of Public Health as, and I quote, necessary for preserving access to health. We call on Governor Baker to use his authority to immediately halt Trinity's closure plan. These beds must be kept available for the many patients who need them now and many more who will need them as this pandemic continues.
We are here to ask the governor to order this facility to remain open. The Department of Public Health calls it essential. We do not think that this is something that should be allowed to happen just to maximize the profits of a multi-billion-dollar corporation that has received $600 million of federal money to help it survive. That is where we are. That's the turning point in history. June 30th, as a deadline, we are going to need this State House, the governor, to make sure that those psychiatric services continue to be provided for the children of Western Massachusetts. So thank you all so much. Thank you to the nurses. Thank you all so much. You know, nurses are heroes. Nurses are heroes, but heroes need help, and the help has to come.
I'm here today as a mother of a child who accesses these services quite regularly. My son's mental health conditions require intensive care. And it's important to know that Providence Hospital is the only spot that we have in Western Massachusetts where I reside. They need to remain open because our families don't need to come over here to Boston every other week just to get the care that they need. We don't need to sit in an emergency room for 3 weeks to get a bed when we have beds in Western Massachusetts. Why are we being shipped to Connecticut? Why are our services going out of state? We deserve the treatment. I don't understand why that's not happening, Governor Baker, but we want to know why you're not stepping up, and we want to know why you're not supporting all of the families.
So I drove out here this morning. It's about 98 miles from this very spot to Providence Hospital in Holyoke. But in lots of ways, it might as well be 10,000 miles away. We've been working on access issues for years, and now during this crisis, we have a multi-billion-dollar corporation taking advantage of it, and that's what's sickening. But I'm here to stand with all of you and to say that equity is important, services are important, and if it's a financial fix, let's figure out how to fix it and fix this broken healthcare system. Thank you all for being here this morning.
Residential beds do not replace inpatient psych beds. They just don't. We need this to stop. We need the essential services bill to pass. We need to keep these services. We need real parity, real equity in mental health, and it's got to start today. So if you haven't made a phone call to Governor Baker, call him, tell him, essential services now.
Elizabeth Warren has sent us a statement of support that I'd like to read to you. Thank you to the Massachusetts Nurses Association for organizing today's event. I'm deeply concerned about the planned closure of Providence Behavioral Health Center in Holyoke. Residents of Western Massachusetts should have access to quality, affordable, social, and behavioral health services. The entire congressional delegation and I will serve as a support system for the nurses, employees, families, and patients during this difficult public health crisis. And this is a public health crisis.
These are remarks from Senator Velas. In the past few weeks, my office has heard from many constituents who are deeply concerned about the closure of pediatric and adult psychiatric beds at Providence Behavioral Health Center. As a lifelong resident of Western Massachusetts, I know all too well the impact that the hospital has had on the lives of those who need psychiatric care. The hospital has been a fundamental part of our community's healthcare system, which is why the Department of Public Health has deemed them necessary for preserving access in health. The loss of these beds will affect hospitals all across the region and will put more pressure on emergency departments that are already overworked during this pandemic. This closure will have a detrimental effect for years to come and is simply not the thing to do. I am proud to be working alongside so many great advocates and officials and wholeheartedly urge Governor Baker to halt this closure and protect our access to quality health care.
Good morning. I drove from Springfield, Mass. All the way out here. I work at Mercy in the ER, and I am directly affected by Governor Baker wanting to close Providence. We're not going to be able to care for these patients the way they deserve. We're not going to be able to advocate for them and maintain their safety in the way that they deserve. So I think Governor Baker should not close Providence because it's such an essential part of Western Mass. Mental health is a huge issue, and it's not being addressed the appropriate way.
So that concludes our rally here this morning. You know what you all have to do. You need to call Governor Baker. We need to protect the patients. We need to be the voice of the patients that need our help more than ever right now. So I know that we're on the right side because the rain and the thunder held off until we completed all this. And I do want to thank Darlene, who is joining us here from the Greater Boston Labor Council, because this doesn't just affect Western Mass, this affects everyone. This is a human rights issue, and this is something that we all have to be protective of the very patients that can't be out here today to be talking about what the needs that they have. So we're counting on all of you. Please spread this as wide and as far as you can and make those calls to the governor today. Thank you, everyone. Thanks so much.